There's a new resource in town. It's called the Health Channel. All health, all the time. It's a partnership between South Florida PBS and Baptist Health South Florida. It allows viewers to connect with doctors and medical experts 24/7 and get their health questions answered. Let's take a look.
Launched in South Florida in May 2018, the Health Channel broadcasts a combination of live and recorded programming. The live programs invite viewers to dial into medical specialists who answer their pressing health-related questions, providing in-depth explanations on important topics that can make a difference in their lives.
And here to share more about the new Health Channel is Bill Scott, Executive Vice President of South Florida PBS, and Dr. Bernie Fernandez, CEO of Baptist Health Medical Group. Thank you both for joining us today. So, Mr. Scott, let's start with this. What is the genesis for all this?
Twofold. One, over the past many months, South Florida PBS has been conducting community interviews, listening sessions. So the public has spoken and told us what's important to them in the listening sessions, and we've listened and we've heard, because at the top or near the top of every one has been concern about health, how they can have access to health information and how they can improve their health for themselves and their families.
It's no secret, a lot of newsrooms, not just in South Florida, but across the country, they've cut back in the reporting staff. And one of the hardest hit areas are health reporting. There's not as many reporters who are dedicated to health reporting. Do you hope there's sort of a void filled there?
Well, beyond filling a void, and certainly we would be doing that, is the fact that the Health Channel is unique. There's nothing like it in America. 24/7, it's there and really offers to the public the answer to this. What do you want? We do what you want, when you want it, where you get it, and how you get it. It's a convenience factor as well as a full information factor, 24 hours a day, 7 days a week. So this is new, it's unique, and we expect that we will have a terrific impact on the well-being of our communities.
So, Dr. Fernandez, what's the reception? What have you been hearing?
It's been extremely overwhelming and positively overwhelming at that. Folks are excited that they'll have what some of them have actually termed, we can have a consultation with a doctor on television. We can call in, ask any of the questions that are relevant to my family or myself, and I can get an expert's opinion. It's not meant to be a medical opinion, but an opinion nonetheless on things that I can do to either improve my health, improve my wellness, or even a medical condition. Where can I go get further help?
And folks are able to, reach out to the doctor and voice their question and get the question answered.
Absolutely. They can get all their questions answered, and whatever shows are done, and whatever topic or medical illness or condition or prevention, all those are captured and they stay there as a resource, permanent resource, forever.
What are you hoping, you seeing, the health of South Florida and where the problems are? Where do you hope, what area do you hope that we're really able to educate the public on?
I think that's a great question, and one that Bill and I have talked about. It's the piece that we're missing in medicine or health is it's more about education. We talk a lot about education. Healthcare costs continue to increase, and that's a major problem. But it's been called a national security issue. So we believe that we can play a role in by educating the public on either prevention or wellness or even compliance with whatever medical condition they have, that we can be another vehicle to lower the healthcare costs. I'll give you an example.
Okay.
The public doesn't even know, and occasionally, what they should do in terms of a medical emergency. Should I go to the emergency room? Or what they determine is a medical emergency. Should I go to urgent care? Can I go to my primary care doctor? Having that as an information, if you can solve something with your primary care physician, and you understand and you've learned it from us, what the differences are, and avoid going to an emergency room, you have now gone to a lower cost of care that's more appropriate for your issue and your condition than having to a very expensive, probably already overcrowded emergency room where many people are using it for primary care services. So that's just a little snippet on how you can lower the healthcare dollar and the costs that we're surging in America by going to the right place.
And I was going to say there is a lot of need for education in our community, especially when it comes to heart health, diabetes. Are you seeing a lot of requests for information on some of those?
That's one
issues?
of the most requested shows on nutrition and diabetes. So we're concentrating on not just treating illnesses or providing information about illnesses, is how to prevent them. And if you have it, how can you make it better? Because a lot of what we do with our own health is, our own behaviors, their own things that we do. Either do not exercise, be having a sedentary lifestyle, or we're eating too much, or we're eating too late, or we're not eating the right types of food. All that is part of what we're trying to accomplish and bring into the show by demonstrating to the public that healthcare is a team sport. So we're bringing not just a doctor, we're bringing exercise physiologists, we're bringing nutritionists, we're bringing nurses, psychologists. So we want to do the entire person, the entire individual.
Mr. Scott, so we're 4 hours a day. You're shooting live interviews, right? You're recording live,
Yes.
or shooting live, I should say, for 4 hours. Then you're replaying those in case somebody missed it. They can catch it. Then there's also other programming. Tell me about that.
We have in programming access to programs produced over a period of time by public broadcasting system, and we get from PBS and play them a variety of programs at various hours during the day and the night, so that available to the public, and this is the key, at their convenience, 24 hours a day, 7 days a week, there is access to solid, credible health information. Credibility is a key and a key concern of the public when they look at something that says, we're here to help you with health. Well, the fact is, you don't get more credible than PBS in terms of 15 years in a row of the most trusted institution in America, and you don't get more credible in the terms of medicine than the Baptist Health South Florida. So we assure people, not only you have access to information, you can bank on that information. It's there for you, and it's easy to access at any time.
And what's your vision for this in 5 years?
We look ahead to get the programs produced maybe 5 minutes, but as far as 5 years, our vision is our hope, and our hope is that we will help to improve the health and the lives of people in South Florida and their families. Where it goes from here, we will follow the direction of the public when they tell us, as they tell us, what is it they need? And it's clear they need information on health.
Well, I thank you both so much for joining us today. We truly appreciate it. Mr. Scott, Dr. Fernandez, thank you so much for your time. We appreciate it.
My pleasure. Thank you.
Thank you.
And to learn more about the new Health Channel, where you can watch it in your area, and to catch up on the latest videos, visit allhealthtv.com.